Hey everybody, it's Dr. Kadisha, your board certified emergency medicine physician, best-selling author, creator of the Mini Mobile MD Kit and the Mobile MD Kits. And I am here just to give you a little update and just to remind you of ways that I can help with what is going on right now. So first, what is going on right now? I got a couple of things that I wanted to talk about with you, but we'll just see if a couple late nighters, night owls are up, just given my shift work life. I'm often up, usually during a 24-hour shift. I might be expected to catch a second wind around this time as people come into the ER, after work, after school, after dinner, things like that. It's amazing, but sometimes things actually pick up now. And it is a Monday night. So I think it's Monday, again, shift work life. And Monday nights in the ER can often be pretty hectic. So if you happen to catch this after the live, do hit hashtag replay. And just want to get to a few things that have been going on. First, I do want to tell you a lesson from my last shift. So, and this is nothing new, actually. And welcome to the person who just came in. Do make yourself known in the comments. Do hit like, do hit share. Have that other person hit share. I would really appreciate it. Today is Monday. I had to remind myself because, again, it is, shift work life. I worked a 24-hour shift on Saturday going into Sunday, and I come on at 6 a.m. in the morning, and I'm on shift until 6:30 the next morning. So sometimes it's easy to get disoriented. But anyway, I'm working Saturday night, and I was reminded yet again of this adage that I've come to share. And it goes like this: put the kids to bed because they'll mess up their head. Often on the weekends, parents let their kids stay up late at night, and the kids that are brought in late at night typically have been on the couch, and they're jumping on the couch, and somehow their face or their head always ends up hitting the edge of the coffee table. And I had a little one Saturday night who was about 4, and the family brought him in around maybe 11 p.m. on a Saturday. 4 years old, up at 11 p.m. on a Saturday night after jumping off the couch and hitting his face, more like the bridge of his nose, on the edge of the coffee table. Mom was alarmed because he vomited twice after hitting his head like that. And of course, that is concerning for a severe head injury. We watched him, we monitored him, we did imaging of his head to, check for any damage, at the very least, a broken nose, things like that. He was fine. He was awake, alert, and appropriate, playful during his ER stay. But, I still advised Mom to, watch him, wake him up every couple hours to make sure he was still at his baseline mental status. And so, certain guidelines say, after certain injuries that might seem severe, you don't have to wake folks up every couple hours anymore. But I mean, if it was my child, I would want to do that. I would want to, just make sure that they're okay, especially during the first 24 hours after a head injury. I still want to do that. So I just advise that if a child is under 10, they should probably be in bed or at least winding down before 10. Otherwise, I've had to put put stitches in 6-year-olds, 4-year-olds, 2-year-olds, well after 10 o'clock because they're running around, jumping off the bed, jumping off the couch too often, jumping off the couch. Hey, everyone, thanks so much for coming in. I'm just warning folks about having little ones staying up late at night and increasing their risk of head injury. I was just saying a couple nights ago, I had to evaluate a 4-year-old who had been jumping on the couch. He jumped off the couch and hit his head on the edge of the coffee table at 10:30 at night. A 4-year-old up at 10:30 at night jumping around. Why not save yourself some time, some money, and save your own energy as parents by putting your children to bed, or at least having them, just lay down before 10, especially if they're under the age of 10. So I'm getting off my soapbox. Okay. So on to some, a little COVID update. Okay. So, now that vaccinations are increasing, millions of us are, being vaccinated worldwide. There's signs of pandemic fatigue going on. And if you go to my Instagram site now, Kadisha_MD, you'll see a post that I put up after watching that was shared from MSNBC. There was a video of people burning surgical masks and the newscaster asking a physician who was head of quarantine and isolation for the housing works in New York City. He was asking her what she says to people with pandemic fatigue. How should we be thinking about this pandemic fatigue? The weather's getting better. Spring break was either last week, this week, or is next week, depending on what part of the country you live in, what school system you're in. And, and then states are lowering their mask mandates. Mississippi let theirs go. Alabama let theirs go. Texas let theirs go. President Biden is, asking the states to please reinstate their mask mandates because cases are going back up. And yes, I can still remember last year, former President Trump saying that, the coronavirus will be over by Easter. Well, a year later, we know that that's not happening. Just because the weather's getting better, yes, it may, tamp down a little bit, but it's not going away. And according to, places like the Mayo Clinic, CDC, they do say, and this is based on years of research of other viruses, that it may take years for a virus to settle into a predictable pattern. Even though we've had to deal with this COVID-19 for over a year, it's still not predictable. We still can't say we know what it's going to do. We still cannot say that. And even with the vaccinations increasing, we are nowhere near the percentage of the population that should be vaccinated. We are nowhere near. Yes, more of us are getting vaccinated, but there's still not enough of us who are covered for us to stop in any way any of the safety measures that we've been told to take. There's in no way any reason for us to stop masking up, stop social distancing, stop using hand sanitizer and things like that, because even those of us who are vaccinated can still catch the illness. It's very rare. It's very rare for a fully vaccinated person to catch the infection. But if we do catch it as a fully vaccinated person, we can still pass it on to someone else. We might have the infection, but be asymptomatic. Just look at it that way. Remember that people who are fully vaccinated, while it is rare for them to catch the COVID-19 infection, fully vaccinated, they can be asymptomatic carriers of the illness. So we, as those vaccinated, we still need to wear masks and things like that. Now, I will let you know, and what is fully vaccinated? So fully vaccinated is, say you got the Pfizer or the Moderna vaccine, you should be considered fully vaccinated about 2 weeks after your second dose of those vaccines requiring 2 doses. So 2 weeks after the 2 doses, you are fully vaccinated. If you got the Johnson & Johnson vaccine, then you are considered fully vaccinated 2 weeks after that dose of the Johnson & Johnson vaccine. And again, people are worried about allergic reactions. Well, according to Consumer Reports, there were only about, and let me check my notes, 71 cases of anaphylaxis in the first 18 million vaccine doses. There were 71 anaphylactic reactions among the first 18 million. So 71, that's less than 100 in over 15 million, almost 20 million vaccine doses. So 71 severe allergic reactions, anaphylactic reactions, and 18 million vaccine doses. So the allergic reactions, the severe allergic reactions are very, very rare. And if you've had severe allergic reactions, because that was another question, what if I've had severe allergic reactions to things? Well, it depends. If you've had an allergic reaction to something that is not related to a vaccine, or is not related to an injectable medication, then you should still be able to get the vaccine. You should still be able to get that. Now, if you've had an immediate allergic reaction to other vaccines or injectable medications, then you ask your doctor, should you get the COVID-19 vaccine? And if you've ever had an immediate allergic reaction to, like, say, your first dose of the COVID-19 vaccine, then you should probably not get that specific vaccine as the second dose. You might be able to get a different vaccine for your second dose if you got the Moderna or the Pfizer. You could maybe just, if you got one, get the other as your second dose. And, while typically after getting vaccinated, the person who vaccinates you or that facility watches you for about 15 minutes. If you have a history of severe allergic reactions, the recommendation is that you are watched for 30 minutes. So you're watched for about half an hour. Another question is if the vaccine is safe for pregnant or breastfeeding women. And currently there's little or no research on the safety of COVID-19 vaccines in pregnant or breastfeeding women. But if you are pregnant or breastfeeding and you're part of the group that is recommended to get the COVID-19 vaccine, then you may choose to get that vaccine. Just talk with your healthcare provider about the risks and benefits of getting the vaccine. So if you're pregnant or breastfeeding, there's no research on that right now. The jury is still out. However, if you have some significant conditions, illnesses, then you may want to speak with your healthcare provider about getting the vaccine. Anyway, despite there not being any research. So people say, all right, well, why not just get COVID and avoid getting the vaccine? Well, you can, if you do that, know that while the vaccine is relatively new, it is known that natural immunity from having been infected with COVID-19 will not last as long as the immunity that you get from the vaccine. So not only is natural immunity not as long lasting, getting it the natural way, getting COVID-19, just catching it from someone else, puts you at risk for severe illness or complications. Even if you feel like you are healthy, you're in the best shape you've ever been, and all of that. I've been told that by many young people. There are young people who've had no known medical conditions who had severe illness and who lost their lives to COVID-19, because you don't know. There could be an underlying condition that you have that COVID-19 could unmask just because of the nature of it. So don't take your chance with just going to say, because I know, it's time, it's spring break. We saw those young folks out there on the beach in Florida. I think some people are still believing in these COVID parties where it's usually people who are relatively young and healthy who go just hoping to catch COVID-19 and get it over with. You can try that, but you're taking a risk because you still don't know what you might have masked within your system as far as illnesses or things like that. And you don't want to take a risk of unmasking it by, willfully catching COVID-19. The best way to shore up immunity is to get vaccinated with it. And if you're in places where it's not entirely easy to get vaccinated, like I know that, here in Houston, it seems to be getting easier and easier. I've gotten text messages. People I know have gotten text messages from various hospital systems at which they've received treatment stating that you can now make arrangements to get vaccinated. However, up in Maryland, I'm not hearing so much about organized efforts, and maybe there are efforts being made. Definitely put in the comments, what is going on in Maryland. But my poor mother's up there; she still hasn't been able to get vaccinated. We checked on multiple drugstore websites, and they were completely booked as far as appointments to get the vaccine. Meanwhile, here in Texas, I'm getting text messages about, you can make arrangements to get vaccinated here. You can get, my church even texted me to say you can register to get the vaccine starting this weekend. So consult your local health department to see how you can possibly get your vaccine. Folks feel absolutely helpless, but we do have state health departments, local health departments that know everything that we need to know about how to get started as far as getting the vaccine. Now, as far as children getting the vaccine, because, that is a concern. Children may be asymptomatic, or they may have that runny nose that we think is an allergy, and they're running around, hugging everybody, touching everything and all of that. People are wondering, when can these kids get vaccinated? Because, every other year, they're the main ones spreading the viral illnesses, spreading the bacterial illnesses. How about getting them vaccinated? So there's no COVID-19 vaccine yet for children under age 16. However, several companies have started enrolling children as young as 12 in COVID-19 vaccine clinical trials. And studies including even younger children than age 12 have begun. So they are working on that. Now, you might wonder though, say you've been completely vaccinated, and, shouldn't there be some kind of freedom? Now that one has been completely vaccinated? There's some freedoms that some of us can start to have. It doesn't mean that you can, just go to the drugstore without wearing a mask anymore. But the CDC says that after getting the COVID-19 vaccine, it's recommended, and this is from the Mayo Clinic and the CDC, they're saying that it's okay for fully vaccinated people to visit other fully vaccinated people indoors without wearing masks, and without avoiding close contact. So that's what the CDC is saying can happen between people who are fully vaccinated. Fully vaccinated people can visit unvaccinated people from one household who are at low risk for severe illness from COVID-19. They can visit them indoors and without wearing masks or without avoiding close contact. So if you are fully vaccinated meaning it's been at least 2 weeks after your second dose of the 2-dose vaccine. So 2 weeks after the 2-dose vaccines, or 2 weeks after the 1-dose vaccine, then you can visit unvaccinated people from one household who are at low risk for severe illness from COVID-19 indoors and without wearing masks or avoiding close contact. Now, the other thing, though, is vaccinated people should continue, again, to take safety precautions such as wearing a mask and avoiding close contact with others when they are, and that includes me. So when we're in public, fully vaccinated people still need to mask up and socially distance. When you're visiting people who are unvaccinated and at increased risk for severe illness, so if you're fully vaccinated and you're going to go visit your grandparents for Easter this weekend, you still have to socially distance. You still have to socially distance and wear a mask, even if you're going to go visit grandma. Hey, Dr. Ken, thank you so much for coming on. Thanks so much for your support. I appreciate it. Because, I know Easter is coming up, and I know how some grandparents, they love Easter almost as sometimes more than Christmas. And, they're going to want to hug and all of those things. So, even if you're fully vaccinated, still socially distance from grandma and grandpa. If you're fully vaccinated, you should still take precautions visiting people who are unvaccinated from multiple households. So still limit the number of households you visit as a fully vaccinated person. You still need to mask up and socially distance yourself. Because remember, those of us who are fully vaccinated might have a low risk of catching COVID-19, but we might spread the COVID-19 virus to others, even if we have no signs or symptoms of COVID-19, because we can still be carriers. Because one thing that really gets me is that people aren't being tested for COVID before they are vaccinated. It just seems like people should be tested for COVID before they're vaccinated, because, some people are getting really, really sick. And I actually had a patient who thought she was having an allergic reaction or some kind of reaction to the COVID-19 vaccine, and she actually had COVID-19. She actually had it. And, people are probably saying, well, was it because she was vaccinated? No, she was just vaccinated about 3 days before. She was vaccinated about 3 days before. And just know that before you are fully vaccinated, you can still catch COVID-19 with some pretty significant symptoms. So even though you had the first of the 2 vaccines, you can still catch it with symptoms. And so I saw this lady, tested her, found her positive. let her know, hey, you're not having a reaction to the COVID-19 vaccine. You have COVID-19, and we saw it on the chest X-ray. Tell everybody, tell your friends, tell your family. You can see COVID. You can see it on a chest X-ray. You can see it on a CAT scan. All you have to do is Google it. If you're not a healthcare professional who's going to see it real time, you can Google, COVID-19 pneumonia on chest X-ray, COVID-19 pneumonia on chest CAT scan, and you'll see pictures of COVID. You will see it face to face. So she had it, and she let me know that she had her children staying with her at her parents' house, so their grandparents' house. She said, so, what do I do? I said, you have to isolate yourself. When you have COVID-19, when you have the infection, they call it isolation. When you've been exposed and there's concern for you becoming infected, they call it quarantine. So I said, you need to isolate yourself. Well, don't you know, 2 or 3 days later, both her parents show up at the ER. I just happened to be working, and they both had it. So let's see. Alicia Angel Faith Forrest says, precautions never hurt. People should not take risks. Just mask up, stay sanitized, and think about others. Exactly. I could not have said that better. I couldn't have said that better. So this woman got vaccinated, got her first shot, caught COVID-19, or she had COVID-19 when she got that first dose, and she had spread it to her parents, older people. She spread it to older people, her parents. So that's another thing. Just know that you can still catch COVID-19 while you're in the process of becoming immune by way of the vaccine. You can still catch it. You can still give it to people. Even if you're fully vaccinated, we can still catch it. It may be little to no symptoms, and we can still give it to people. So that's one thing that I wanted to share. And I have to let you know that, as part of my new telemedicine service under the RAP Medical Group, I will answer COVID questions with you, address any concerns that you have. You can make an appointment here at therapmedicalgroup.com, and we can talk about, your COVID symptoms, isolation, possibly when you can stop isolation, dealing with, staying home while COVID positive. We can talk about any lab or imaging results you have after a doctor's visit. Hey, even after an ER visit, that's even better. I can help you, if you come away from a doctor's visit, be it your primary care doctor, your specialist, or an ER visit, if you came away with more questions than answers, as can sometimes happen, you have this ER doctor at your fingertips and we can discuss your imaging results. I know personally, I have given patients their imaging and lab results, gone over them, printed up the discharge instructions. The nurse goes in with the discharge instructions, and the patient will ask them the same questions that I answered for them about 5 minutes prior because of, whatever mind state they're in. That might have gone in one ear and out the other, as far as what I discussed with them. And then, then you get yourself home and you still might have other questions. And usually there's no way that ER doctor can get on a phone with you if it's a busy time and go over your lab results again while they're on shift. That's so why not have an ER doctor who you can speak with virtually about your results? And so in addition to that, I can also, help treat some minor or urgent conditions so that you can see an ER doctor and be treated from the convenience, cleanliness, and safety of your own home. So definitely feel free to make an appointment with me. I'm licensed in Texas, Pennsylvania, and California, with more states to come. at therapmedicalgroup.com. And I thank you so much for joining me. We're coming, let's see. Oh, and Alicia says, thank you so much for your knowledge on this. It's so important for everyone to get a clear understanding to help. Yes, indeed. Thank you. Thank you so much, Alicia. And definitely share this information with anyone that you feel could benefit from it, friends, coworkers, because I know there's a lot of anxiety and fear, and there's a lot of misinformation out there. And ER doctors don't have a lot of time to address these questions and concerns. So definitely, if you need to do so, make an appointment with me. You can also check out my book, Help Us Help You in the Emergency Room. You can go to helpushelpyoubook.com and get that book that I made as a result in response to 20 years of questions, concerns, and complaints people have had about the ER, misunderstandings, miscommunications, unnecessary testing, inflated bills, things like that. I've written a book to address those things for people as well. And I got that freebie for you. You can go here at safetyforsuccess.com. I have a freebie for you, more information from me. So again, I'm Dr. Kadisha, your board certified emergency medicine physician. Check me out on Instagram at dr_Kadisha_MD. Check out my book, Help Us Help You. You can go to helpushelpyoubook.com and get your book. And you can also make an appointment to speak with me at therapmedicalgroup.com. So I hope you guys will be safe and be successful. And let me know of other topics that you'd like to talk about in the comments. And we'll talk soon. We're going to talk soon. Tomorrow, Perspectives in Primary Care. I'll be back on with Drs. Dietrich and Dr. Carroll, and we're going to be talking about multiple sclerosis on the Perspectives in Primary Care Facebook page. That'll be tomorrow at 7 p.m. Central Time, 8 p.m. Eastern Standard Time. We'll be talking about multiple sclerosis on the Perspectives in Primary Care Facebook page. So join me and the gang tomorrow as we discuss that. And I thank you so much for joining me. You guys have a great night. Get some good sleep. Be safe, be successful, and I'll see you tomorrow. Bye.